Most men don't expect this, but after age 60, your penis begins to age faster than almost any other part of your body. Blood flow slows, sensitivity dulls, and small warning signs often go ignored. What's more shocking in many cases, changes in your penis are the first signs of serious health issues like heart disease, diabetes, or even early-stage cancer, and yet hardly anyone talks about it. I'm Dr. James Ellison, a urologist and men's health specialist with over 3 decades of experience helping men navigate aging with strength, clarity, and confidence. I've worked with thousands of patients across the country, and I can tell you, taking care of your penis isn't just about sex, it's about dignity, longevity, and the ability to feel fully alive in your body. Here's what most men don't realize: even if everything seems fine, silent damage may already be happening, but the good news is, it's never too late to take control in this guide. I'll show you 5 essential ways to care for your penis after 60 simple, powerful steps that can improve your health far beyond the bedroom. And by the end, I'll reveal the one habit almost every man overlooks. Yet it may be the most important of all. Before we begin, if you haven't already, I encourage you to subscribe and turn on notifications so you never miss important health advice tailored specifically for men like you. And if this message resonates with you, type 1 in the comments. If it doesn't, type 0 and let me know how I can better support your health journey. Now that you understand why this conversation matters, let's get into the first and perhaps most critical step. Because without it, everything else can start to break down. If you want to protect not just your sexual health, but your heart and brain too, this is where it all begins: keeping the blood flowing. 1. Keep the blood flowing. Circulation is everything. I remember one of my patients, Harold, who came to see me at 67. He sat down, looked me in the eye, and said, "Doc, I don't feel like a man anymore." He wasn't talking about his identity. He was talking about the slow, quiet loss of something he hadn't even noticed: disappearing healthy blood flow to his penis. No pain, no obvious symptoms, just less fullness, less response, less sensation. And it scared him. What many men don't realize is that the penis is like a window into your cardiovascular system. It has some of the smallest blood vessels in your body. When those vessels start to narrow, your penis is often the first place to show it. In fact, studies show that erectile changes can appear 3 to 5 years before a major heart event. That means your penis may be warning you long before your heart does. But this isn't just about preventing disease. Proper blood flow is essential to keeping the tissues of the penis alive, elastic, and responsive. When circulation declines, the smooth muscle fibers within the penis can begin to atrophy. This leads not only to weaker erections, but also to long-term structural changes that can make intimacy feel foreign or even impossible. The good news: blood flow can be improved. It's not about waiting for a problem to show up. It's about making simple, powerful changes right now. Walking just 30 minutes a day can dramatically boost circulation throughout your entire body, including to the penis. Strength training twice a week, managing your blood pressure, and quitting smoking. If you haven't already, these aren't just heart-healthy steps. They're penis-saving ones. And yes, even diet plays a role. Foods rich in nitric oxide like leafy greens and beets help dilate blood vessels naturally. Omega-3 fatty acids found in fish can reduce inflammation and keep blood flowing smoothly. I've seen men in their 70s and 80s regain a level of responsiveness they thought was long gone just by taking circulation seriously. When Harold came back, 6 months later, he was a different man, not just physically, emotionally. He smiled more, he carried himself differently. He said, "I feel connected again to myself and my wife. I thought I'd lost that forever." That's what keeping the blood flowing really gives you: not just the ability to perform, but the ability to feel, to connect, to live fully. But circulation is just one piece of the puzzle. There's another critical area where most men fall short, something so basic, yet so often ignored, and if you're not doing it right, you could be putting yourself at serious risk without even knowing it. Let's talk about that next. If you're still here and this message is resonating with you, type the number 1 in the comments to let me know you're still with me now. Let's keep going and dive into the second essential step you need to take too. Keep it clean. Hygiene isn't optional. There's something deeply personal about this topic, and yet it's one most men never bring up until there's a problem. I remember sitting with a man named Paul, 72 years old, a retired truck driver who had been quietly dealing with irritation, discomfort, and a smell he couldn't explain. He was embarrassed, hesitant even to describe what was going on. When we finally examined him, it turned out to be a fungal infection beneath his foreskin. Something completely preventable with the right hygiene. What struck me wasn't the diagnosis. It was how long he had waited to ask for help, and Paul isn't alone. Many older men, especially those who are widowed or living alone, let personal care slip. It happens slowly. You get used to your routine. Maybe bending over gets harder, or your eyesight isn't what it used to be. But in the process, the penis is often left neglected, and over time that can lead to serious issues. Proper hygiene isn't just about staying clean, it's about protecting one of the most sensitive, vulnerable areas of your body. Poor hygiene can lead to painful infections, inflammation, and even increase your risk of penile cancer, especially in uncircumcised men. Moisture trapped beneath the foreskin creates a perfect breeding ground for bacteria and yeast, and when left unchecked, small irritations can turn into chronic problems that affect not just your physical comfort, but your confidence and sense of masculinity. But here's the hopeful part. Good hygiene doesn't require anything complicated. It starts with warm water and gentle care, daily washing, gently pulling back the foreskin. If you have one, rinsing away sweat and debris, then drying thoroughly is often all it takes. Avoid using harsh soaps or scrubbing, which can strip the skin of natural oils and cause micro tears. Simple, intentional care goes a long way. I've had men come back after just a few weeks of improving their hygiene habits, telling me they feel more in control of their bodies again. Their partners notice the difference too, not just in scent or appearance, but in how they carried themselves, how they reconnected physically and emotionally. That's the hidden benefit of hygiene. It's not just about being clean, it's about feeling worthy of closeness, of touch, of intimacy. Caring for your penis is an act of self-respect. It's a message you send to yourself: I'm still here, I still matter, and I'm not giving up on my body. But hygiene is just the foundation. There's another layer to care that's just as vital, something most men over 60 stop doing, even though it plays a powerful role in keeping the penis healthy, responsive, and alive. Let's explore that next 3. Stay sexually active, even if it's not intercourse. A few years ago, I met Richard, a 69-year-old former Navy officer, stoic, strong, proud. He came into my office, not for sexual problems, but for fatigue and mood swings. During our conversation, he quietly admitted that he hadn't had any kind of sexual activity in over 2 years, not even self-stimulation. It just didn't feel important anymore. He said, but I could see it in his eyes. What he really meant was, it didn't feel possible anymore. What I told Richard is something I want every man over 60 to hear: staying sexually active, whether through intercourse, touch, or solo stimulation, is not about proving something. It's not about performance. It's about preservation. Your penis is made of living tissue that thrives on oxygen movement and stimulation. Without regular activity, those tissues begin to stiffen, lose elasticity, and become less responsive. And that change isn't just physical, it affects confidence, energy, even how connected you feel to your own body. Sexual activity keeps blood flowing to the penis, helps maintain nerve sensitivity, and supports hormonal balance. It also boosts mood by releasing dopamine and oxytocin chemicals that play a role in emotional health and resilience. In other words, regular sexual expression isn't just about sex, it's about feeling alive. And here's something important. Intimacy doesn't have to mean intercourse, touch, arousal, stimulation. These all count for men dealing with erectile challenges or health issues. Shifting the focus from performance to connection can be liberating. Whether with a partner or on your own, finding ways to stay engaged with your sexuality is one of the most underrated tools for maintaining penile health. I've seen men return to themselves simply by reintroducing this part of their lives. One man in his 70s told me after a few weeks of reconnecting with his body, "It was like I found a part of myself I thought was gone. I walk differently now. I feel like myself again." There's no shame in aging, but there's also no reason to surrender parts of yourself that still have life in them. You deserve connection, you deserve pleasure, and most importantly, you deserve to feel at home in your own skin. Still, as powerful as sexual activity is, it's only part of the picture. There's something happening beneath the surface of your body, especially as you get older, a quiet hormonal shift that most men don't notice until it starts affecting every part of their life. It's the hidden driver behind low energy, low drive, and yes, sexual changes too. Let's talk about that next. If you're still watching and finding this valuable, go ahead and comment the number 1 below. I'd love to know you're still here with me now. Let's continue with the 4th essential step you need to know. 4. Watch your testosterone, but be smart about it. When Thomas first came to see me, he was 74. He looked healthy on paper. His cholesterol was managed, blood pressure under control, weight stable. But he felt off. He told me, "I wake up tired, I don't feel like myself, and it's like my body just disconnected from my will." He hadn't been interested in sex for months. He thought it was just part of aging, but what we found was a different story. His testosterone levels had dropped significantly, and they'd been falling for years without anyone paying attention. Testosterone isn't just about libido or building muscle, it's a foundation of male vitality. It supports mood, energy, mental clarity, and yes, penile health. When testosterone dips too low, it becomes harder for your body to maintain. Firm erections, generate sexual desire, or even keep penile tissues healthy. The penis is highly sensitive to hormonal balance, and when that balance is disrupted, it's like turning down the volume on a part of your life that once felt loud, vivid, and alive. But here's the key. Restoring testosterone isn't as simple as taking a shot or slapping on a gel. I've seen men rush into testosterone replacement therapy without understanding the full picture, and in some cases it created more problems than it solved. That's why I always urge men to start with a proper evaluation, not just one blood test, but a full panel checking free and total testosterone, estrogen, PSA levels, and overall hormone balance. And just as important, lifestyle matters. Testosterone is sensitive to how you eat, sleep, move, and manage stress. I've worked with men who raised their levels naturally through resistance training, cutting out sugar, improving sleep, even just reducing alcohol. For others, medical therapy was the right choice, but only when monitored by someone who understands male hormones in depth. What happened with Thomas? We built a plan that combined lifestyle changes and a carefully managed low-dose therapy. Within 4 months, he wasn't just sexually active again. He was smiling, energized, re-engaged with his hobbies, even traveling with his wife again. He told me, "I didn't realize how far I drifted from myself until I came back." That's the real benefit. Testosterone doesn't just support your penis, it helps restore your sense of self. It helps you stay present, purposeful, and physically connected to the life you want to live now. If testosterone is the silent engine running beneath the surface, then the next step is about what you can actually see, touch, and feel. It's the one practice that most men skip, and skipping it could cost you more than you think. Let's talk about that now. 5. Get regular penis exams. Yes, it matters. This is the one no one wants to talk about. I've had grown men, strong men, veterans, grandfathers sit across from me and say, "Doc, I've never had anyone look down there, not since I was a kid." And every time I hear that, my heart sinks a little, because I know how many silent problems are hiding in plain sight, curable if caught early, devastating if ignored. The truth is, your penis deserves the same level of attention you give to your heart, your blood pressure, your prostate. It's a part of your body. It changes, it ages, and just like any other part, it needs to be examined by you and by a professional. I once had a patient, Walter, who came in for a routine checkup. He was 70. Felt fine, just wanted peace of mind during a simple genital exam. I noticed a small lesion. He hadn't even seen it turned out to be an early-stage skin cancer. It was removed completely with no further treatment needed. That exam may have saved his life, and certainly his sexual function. Self-exams are the first step. Once a month in the shower or after drying off, take a look. Use a mirror if needed. Check for lumps, color changes, skin thickening, or unusual bends or curvatures. If you're uncircumcised, pull the foreskin back gently and inspect underneath. This is not vanity. This is responsibility. Knowing your body means you can recognize when something isn't right before it becomes dangerous. The second step is asking your doctor, yes. Asking for a genital exam during your yearly physical. Many general practitioners skip it unless prompted, but a trained eye can spot early signs of Perron's disease, like ankylosing infections or vascular changes that signal bigger problems. These conditions are treatable, but only if you speak up. I've had patients tell me that this one step made them feel more in control than any pill ever did. Why? Because it's not about reacting to a crisis. It's about choosing to stay engaged with your health, your whole health. And when you do that, you carry yourself differently. You don't shrink into the background. You show up fully. And now you've made it through all 5 essential ways to care for your penis as you age. But what does it all mean when you put them together in the final thoughts ahead? I want to share something deeper. Why this isn't just about the penis, but about claiming a part of yourself that still has life power and purpose. Let's wrap this up. Together, 6 final thoughts from doctor to man after all these years of practicing medicine. I've come to believe that the most neglected part of a man's body isn't just his penis, it's his permission to care about it. We're raised to be tough, to shake things off, to act like nothing down there ever changes. But the truth is, it does. And when it does, it deserves attention, not silence. That's what I hope this conversation has opened up for you. We started by talking about blood flow because circulation is the lifeline of not only your penis, but your heart, your brain, your entire body. Without it, nothing functions. Then we looked at hygiene, something so simple yet so often overlooked. Cleanliness isn't just about avoiding discomfort. It's a form of self-respect. You keep it clean because you value it, because you value yourself. We talked about staying sexually active, even if it's not about performance. I've seen men come back to life just by giving themselves permission to feel again, to connect, to touch and be touched. It's not vanity, sensuality. It's vitality. Then we explored testosterone, that quiet current running through your system that affects far more than you may realize. Energy, drive, confidence, even the health of your erections. It's all tied together. Paying attention to your hormones doesn't mean you're broken. It means you're wise enough to listen to what your body's been trying to say. And finally, we talked about the courage it takes to get checked, to look, to ask, to advocate for yourself. That step alone can change everything, not just because it might catch a problem early, but because it tells your body and your mind that you haven't given up on yourself. I've had the honor of walking beside thousands of men through these stages. Some of them waited too long. Others showed up early, uncertain but brave enough to ask the right questions. And I'll tell you this, the men who face these changes with honesty, who treat their penis as part of their whole health, not a separate, shameful thing, those are the men who age with the most strength, grace, and dignity. So if you've made it this far, you've already done something most men never do. You've chosen to be informed, to be open, and maybe to take the first small step back toward your body. Not just to preserve function, but to reclaim something deeper, because your story isn't over, your body still matters, and it's never too late to take care of the parts of yourself you've been told to ignore.